America shutting down. Roughly 1 in 4 Americans are now being told, stay at home.
Tighten the valve. Tighten the valve more. If the number doesn't slow down, close the valve. We're closing the valve.
Schools, restaurants, businesses closing. Airports empty. Unemployment claims soaring. Congress working on a plan to send checks to millions of families.
We need help now. Now.
New cases and deaths spiking here at home.
This is one of the greatest emergencies our nation has faced in generations.
And around the world, testing kits and medical protective gear still in short supply. Younger Americans being struck harder than expected. Many still ignoring social distancing pleas.
If I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying.
President Trump changing his tone. For 2 months.
We have it totally under control.
But now?
If you're talking about the virus, no, that's not under control for any place in the world.
The U.S. facing an invisible enemy with no end in sight.
空荡荡的景象出现在波士顿、底特律、达拉斯、加州太平洋海岸公路和旧金山。这里是美国，2020年的美国。过去半个月，美国新冠肺炎确诊人数从每天以1000人速度增加，自23号起更翻倍到以10000人速度增加。终于在3月26号超越了意大利和中国，冲上世界第一高。
The most cases nationwide now in New York State, the number doubling every 3 days, the vast majority of those cases in New York City.
全美死亡人数也在3月25号首度破千，其中约30%都在纽约市。
Where we are today, you will be in 3 weeks or 4 weeks or 5 weeks or 6 weeks. We are your future.
Across the country in California, where half as many tests have been taken than New York, the death toll and those infected could easily become the highest in the nation.
We are anywhere from about 6 to 12 days behind what we are seeing in New York City.
The U.S. Naval Hospital ship the Mercy heading towards Los Angeles today. The medical crew on board preparing beds and equipment to handle a surge of up to 1,000 patients offshore.
At least 26 states have taken emergency measures to slow the spread. More than half of all Americans under those stay-at-home orders.
States like Florida and Texas have no statewide regulations to keep residents home, leading some to worry they could become the next epicenter for the virus.
New hot zones now popping up across the country. Disaster declarations for Texas and Louisiana.
Today, Bourbon Street is practically a ghost town, but exactly 1 month ago, more than 1 million people packed here for Mardi Gras, and experts say that is a big reason that numbers here are growing faster than almost anywhere in the world.
My EMS department, over 50% of my people are now on quarantine. The state can no longer go on without federal assistance at this time.
One of America's mightiest warships is docked in Guam, with the coronavirus now spreading throughout the carrier. At least 23 of the sailors aboard the Roosevelt have tested positive for the virus, transported to a Navy facility on land where they are quarantined. The 5,000 sailors who remain on the Roosevelt will not be allowed to leave the pier as the Navy tries to stop the spread.
Hospitals in Atlanta and Detroit say they're full. Illinois' governor warns in a worst-case scenario, he'll need another 9,000 ICU beds and 5,000 ventilators by April 6th. In ERs and ICUs tonight, a pitched battle to keep patients alive, but with doctors and nurses still running critically low on protective masks, face shields, and gowns. At Leominster Hospital in Massachusetts, doctors use paper bags to store and reuse their masks.
Where we can see something coming and we can't get the resources here to avert it is ridiculous. It should not happen.
Some healthcare workers are already sick, like San Diego nurse Megan Usich.
Testing is taking 5, 6, 7 days to get back.
Experts continue to warn hospitals could eventually need hundreds of thousands of additional ventilators.
Ventilators, ventilators, ventilators.
He also wants Donald Trump to use war powers legislation to order private companies to build the ventilators he needs. But Mr. Trump has so far refused.
Governor, why is the federal government not getting your message about how desperate the situation is?
You have to ask the federal government. What do I know?
What do they say when you ask them?
I don't know. Their answer is, we don't need to do it because companies are coming forward who want to do it. And by the way, I am sure that is true. It's just the timeline doesn't work. I don't need ventilators in 6 months. And I don't need ventilators in 5 months, 4 months, or 3 months. And by the way, California is not going to need ventilators in 6 months. It is now.
But then by today on Twitter, he pressed both General Motors and Ford to manufacture ventilators and fast.
After China, after Europe, could the United States be the next epicenter?
We are now seeing a very large acceleration in the numbers of cases from the United States. So it does have that potential.
Across America, the rate of growth is accelerating and likely underreported. Some predictions have cases reaching 250,000 within 2 weeks, with the death toll potentially breaching 10,000 by Easter.
Easter is our timeline. What a great timeline that would be.
The US president has grown impatient. He wants the nation to get back to normal as quickly as possible.
新冠病毒早从3月17号就扩散全美，不分肤色与种族。
Senator Amy Klobuchar, who just ran for president, telling us how her husband is now hospitalized and on oxygen.
He was coughing up blood and his oxygen levels were dangerously low. So he's been there for a few days.
She says one of the hardest things for affected families is not being able to see your loved one.
I would rather be there with him right now. And I can't do that. All you can do is call and email and text and try to reach the caretakers who are taking care of them. I've never even met them to get updates.
在现场的人也没有比较好过。一位密西根州的护士在下班的回家路上情绪溃堤。
I don't know what the fuck just happened for the past 13 hours. Honestly, guys, it felt like I was working in a war zone. Completely isolated from my team members, limited resources, limited supplies, limited responses from physicians because they're just as overwhelmed as we are dealing with a ton of other stuff. So basically, I just spent the last 13 hours like treating 2 critically ill COVID patients on the vent, basically by myself. And this is my new normal for the next however many months that it takes for this virus to die down. So, like, I'm already breaking. So for fuck's sake, people, please take this seriously. This is so bad.
1个月前，有一群人经历过同样的痛苦。
Did you get what you need when you needed it?
No.
他们是科克兰长照中心的工作人员，美国第一个爆发群聚感染的 Ground Zero。
How quickly do you see the demise of someone with COVID-19?
Less than 24 hours.
For weeks, this was the location of the most deaths from the novel coronavirus in the United States. Chelsea Ernest is a registered nurse and the nursing director at another life care center facility in Washington state. When an urgent call for help came from the Kirkland facility, she volunteered. She arrived one day after the staff learned a patient tested positive for coronavirus.
Why did you answer the call? You didn't have to be there.
Well, I'm a nurse, and they're not my patients, but hold on, I'm sorry.
It's okay, take a breath.
Ernest and her fellow staff members saw the death toll rise like a rocket. The terrifyingly fast deterioration of the patients always seemed to happen on the night shift, her shift.
That's how I describe it. Is you're going off to war and you're in a battlefield where supplies are limited. The help is slow to get to you. And there's lots of casualties and you can't see the enemy.
Before they all knew it, the virus was sweeping through the entire building. It was the oldest patients who were dying fast.
The average age was 80 years old. The patients, losing them. Because we live with them for so long. It's hard.
According to the CDC and Life Care Center, at the height of infections, 129 people linked to this nursing home tested positive. 29 people associated with this facility have died due to coronavirus.
在每个处境里都有好的一面。那曾经在911时温暖过美国人的琴声再次响起。远方的意大利人也送来他们心底最沉痛的忠告。
Misure di sicurezza prima che scoppia il caos. Per
perché non è che dobbiamo aspettare per mettere mascherine e guanti.